Does your child have health insurance? If not, do you know where to look for options? Sharita McAdoo, Benefit Program Supervisor for Norfolk Human Services, and Courtney Cook, who is a Benefit Program Specialist too, are here to help. You both work in sort of the Medicaid area. You know a lot about benefits programs and what people might need to know before they come in and apply. The children's health insurance, it can be tricky. Where do you start? Where do you begin? What does it cost? If it does cost anything. The Department of Human Services does accept applications for something called FAMUS.
Yes.
And what is that? Do you know what that stands for? Or did I just put you on the spot? It's a long, that's why they call it FAMUS. It's an acronym. Family Assistance for Medical Insurance Security.
I like it.
Does that sound good? She likes it. That'll do. Anyway, it has to do with insurance for children. And Governor McAuliffe has, announced a campaign, of course, to get children who are getting ready to go back to school to get enrolled, because it's an ideal time to catch people when they're thinking about things about their children. So, FAMUS, what does it provide?
It provides medical insurance, dental insurance, and vision insurance.
Okay, so it covers the whole gamut.
Mm-hmm. Yes.
Yeah, so it's pretty good coverage.
Absolutely.
Yes. Covers basically everything.
Wow, so well visits as well as...
Well visits, if they need medication. Yes, ma'am.
Okay, so prescription coverage and the whole bit.
Right.
All right, well, what makes FAMUS different from other health insurances for children?
FAMUS is similar to Medicaid. However, with FAMUS, you have to have higher levels of income between 150% of the federal poverty level to 200% of the federal poverty level.
Okay.
And that's about $12,000 a year for a family of one.
Okay, so some people who may not, say, qualify for Medicaid per se.
They might be over income. They could be eligible for FAMUS.
Okay, so this could include working families or...
Yes,
right.
And we'll automatically see if they're eligible for that when we're screening for Medicaid.
Okay, all right. So it's part of what you do is
Right.
the overall screening process.
Yeah.
What is the age range for a child for him or her to be eligible?
Newborn to 19.
19 years old then is the top age limit for that.
Yes, ma'am.
All right. So since you work in it, I don't know how many people you see face to face. Are there a lot of requests for it, or people?
There are a lot of requests. However, we do not see the clients face to face. Everything is either done through the mail or over the phone.
Okay. So you do get at least to have a conversation with people.
Yes.
Yes.
Okay.
Not everyone, though. Most applications can be approved without even having a conversation with the client or sending out a notice.
Because you've already screened them for a lot of things, so you kind of know.
Well, the way that the new system works, information is passed through the IRS, and if everything is good, is approved, then we can just automatically approve the Medicaid without even talking to them or asking for pay stubs.
Okay, great. Is there any kind of a enrollment fee or any kind of costs or premium costs, monthly premiums for people that...
No enrollment fee. Depending on their income, they may have a copayment.
Okay.
That's anywhere from $1 to $5.
Okay.
So it's nothing overwhelming.
Great. And is there a limit as to how many children in your family can be covered?
No, ma'am.
Okay.
No, you can get everybody covered. If you have 10 children, we can cover all 10 if they're eligible.
Wow. So that's a pretty good deal then.
Absolutely.
For a lot of people. Now, is there anything you can access online, or is it really just through the Departments of Social Services and Human Services?
No, we actually want everyone to either apply online at www.commonhelp.va.gov or apply on phone at 1-855-242-8282.
Okay, and that number is up on the screen right now. There's also Cover Virginia.
Yes.
That you can go to the website there. Also, I have put up here a number for our agency in case somebody calls and they may just have questions about Medicaid in general, and it may be about FAMUS. So this is it, Family Access to Medical Insurance Security. That's what it stands for, and the reason we call it FAMUS is because it's a lot easier to say, and people can remember that. And it's a lot easier to recall. So people, if they're asking for it, aren't stumbling through that long name.
Right.
So thank goodness for acronyms. So medical insurance in general, is something that people really need, but
Absolutely.
how does FAMUS apply to women who are about to have a child, or is that a different category?
No, if a woman is pregnant, she can also get famous.
Okay.
Yes, but only if she's pregnant.
Uh-huh. Right. It's not something that you say, oh, I'm going to get it now. I'll decide to have a child.
Right. Yes.
Yeah, yeah. It doesn't quite work that way. And this is just for the children, correct?
Yes.
Okay. So the age groups then, do they have a list of like providers that?
No, we do not have a list of providers. The person approved would have to call to see if, the provider that they want accepts Medicaid or Famous.
Okay. All right. So the Medicaid and Famous, although it's called something else, is just so people don't get confused. The Famous is for kids.
Yes.
Yes.
And it's been around for a while now.
Yes.
So this launch of getting X number of children enrolled for, a certain time period tells you that there's room for more.
Yes.
So if you have a child that you're wondering about, how do I get them covered? This is something worth checking into. And if you do, and you don't qualify for that, there may be something else that these kind folks can help you with that would help you out.
Yes.
So, have any sense of how many people actually get Famous in Norfolk?
No.
No?
We
A
don't
lot.
have any numbers on that. Yes, it
Yeah,
is a
they got
lot.
some high numbers?
Yes.
Okay.
We process at least maybe
Last year we
close to 1,000 applications a month.
Wow, a month?
Yes.
a month.
My goodness, and that's just in the city of Norfolk?
Yes.
Yes.
Okay.
That's for the city.
And of course, we
Norfolk.
have highs and lows when
Right.
school's about to come in. Everybody starts applying. So there, some months are higher than others.
Okay. That's still a lot, and that takes a lot of people, I'm sure, just to kind of coordinate all of those things. So,
It's a lot.
Teamwork.
there you go. Well, that's how it has to be done. And that's true of any of the benefits programs, too. You all have to
Work
learn about the
together.
policies and all of the things that are involved in making that possible for people to apply,
Absolutely.
and be screened and processed. So it's a lot of work, and you don't often get to see the people that are doing this sitting on a TV set, but, they're a really, really important part of what we do at the Department of Human Services. So you never know. You might be talking to one of them on the phone, and they're there to help you, including with, the application for the Famous program. And so if you have any children that aren't covered or you're concerned about it, call the numbers on your screen. Go to the website, ask questions, and get the answers you need so you know that your kids are covered with very, very good coverage.
Yeah.
That's wonderful. So the idea of having eye vision or vision coverage, I think, and dental, is
Yes.
huge.
Yes, a lot of people don't think about going to the doctor until, the child is actually sick, but it will cover well child visits or, anything else that's going on with the child. If the child needs counseling, for different behavioral issues, it would cover that also.
Right, so it encourages the parents to get more involved with the child's physical well-being
Absolutely.
in times other than just when
To
they're
be
sick and
proactive.
crisis, that type of thing. So it takes the crisis out of it.
It will.
Yeah. Well, great. All right. Well, super. That's wonderful. So the Famous program is available to kids year-round. You'll be seeing commercials. We ran one a little earlier on the new campaign that the state is running in different markets throughout the fall and winter. And we hope you'll apply. And thanks for joining us and just sharing the information, the basic information. We don't want to overwhelm people too much. They're already overwhelmed as it is, just being a parent. But there is help. Help out there if you know where to go for it.
Well, thank you for having us.
All right.
Thank you.
Thank you for being here. And thank you for joining us. We'll see you again next time. Bye.